So we are going to start with the cranial nerve examination. So the first one is the optic nerve exam. This is the olfactory nerve examination. For the olfactory nerve examination, you are going to have, let's say that you have a small perfume or any fruity smell object. You place on one nose, you close the other, and then you place on the other nose, you close the other. You have to visualize if there's any hyposmia or anosmia. The next thing is the next thing that you have to do is look this other side, is to do the optic nerve examination. Optic nerve examination has three parts. The first part is a visual acuity. For the visual acuity, normally you have to use the Snellen chart. But if you don't have the Snellen chart, you can write different numbers with different gradings on your paper in order for the patient to visualize the number. So you ask him to visualize the number and tell you the number for the visual acuity. The next thing, after the visual acuity, you have to visualize if there is the presence of the pupillary reflex. For the pupillary reflex, you have to use any light source, like this my otoscope. You have to place on one eye, you see how it's constricting, and then you have to see if there's any consensual constriction. So you put on this eye and then you visualize the other eye. You put on this eye, you see the other eye constricts. It means that it is a consensual pupillary reflex. The next aspect of this is going to be the visual field examination. For the visual field examination, you place yourself the same distance to a patient and then ask him to close one eye. You close the same eye and then you can use your pen or any pointed object. So in this case, I'm going to use my reflex hammer. For the reflex hammer, you ask the patient to look at the tip of look at the nose. Please, sir, can you look at my nose? And you also look at the nose of your patient. You place the reflex hammer in between yourself and the patient and then ask the patient to look at you. Please, sir, can you see the hammer? Can you see the hammer? Can you see the hammer? It means that he has a normal temporal field of vision and you compare with yours. Similarly, you do it on nasal aspect. Please, sir, can you see the hammer? Please, sir, can you see the hammer? Please, sir, can you see the hammer? It means that he has a normal nasal field of vision and you always have to compare with yourself. So you do it on both eyes. The next thing is to examine the oculomotor nerve. The oculomotor nerve, the trochlear nerve, and the abducens nerve. To examine them, you use the H test. Please close your eye. Please look at my finger. Here, look the finger. Here you assess for the inferior rectus. Here you assess for the lateral rectus. Here you assess for the superior rectus. Here you assess for the inferior oblique. Here you assess for the medial rectus, and here you assess for the superior oblique, and here you assess for the inferior oblique. So those are the different aspects, and then you have to note that each of them have their cranial nerve supply. So the next element that you have to visualize is the trigeminal nerve examination. For the trigeminal nerve examination, you have sensory and motor. Please, can you feel when I touch? Please close your eyes. Can you feel when I touch here? Can you feel when I touch here? Can you feel when I touch here? So I'm assessing both the ophthalmic, the maxillary, and the mandibular region of the trigeminal nerve. The next part is to ask him to clench your teeth. Clench your teeth. You feel for the masseter if there is any bulk. The next aspect is the facial nerve. Please, sir, can you close your eyes? Make sure that I should not open your eyes in my hands. So you see, you use the strength. So you have normal facial nerve. Ask him also to blow. Please blow your mouth. You try to push it so that it should not come out. So those are the different aspects that you have to do. The next element after that is going to be the vestibulocochlear nerve. For the vestibulocochlear nerve, you have to assess two portions. You're going to assess the first portion, which is the cochlear part, that is for audition, with the Rinne test and the Weber test. Your tuning fork should be a grading of 500 Hertz when you are doing the assessment with the Rinne and the Weber test. For the Rinne test, you stroke your tuning fork, place it at the ear, and place it at the mastoid process. The patient is supposed to hear better when you stroke it and place the prongs at the ear than the mastoid process. So it means that the air conduction normally have to be greater than the bone conduction. Also, that is a Rinne test positive, which is a normal test. Also, you can do Weber test by placing the base at this side and asking which ear he hears better. The ear that he hears better, it means that there is more bone conduction at that level, and it may be the pathologic ear. Similarly, for the Weber test, you can place it at the occipital region, particularly the enion, and here it tells him which ear he hears better. Now, after evaluating all this, so this is for the cochlear region. You have now the vestibular region. To evaluate the vestibular region, you try to see for any nystagmus of the eye. It can be an oscillatory nystagmus, it can be a lateral nystagmus, or a rotatory reduction, it can be a vertical nystagmus. After evaluating for the vertical nystagmus, you ask him to lie down, where you are going to do the Dix Hall-pike test. For the Dix Hall-pike test, you turn the head, and then I'm going to push you directly down. You push him down, and then you look at the eyes to find if there is any nystagmus. So, in this case, if you have nystagmus, it means that it is the ear, the vestibular region on the side of the ear that you have turned that is affected. Similarly, you turn the head to the contralateral side, and then you push the patient down. Please, I'm going to push you down. And then you look at the eyes to find if there is any nystagmus. If there is any nystagmus, it means that it's the vestibular region of this ear that is affected. Similarly, you can do with the head up and the head down. So that is for the assessment of the 8th cranial nerve. The next one is a glossopharyngeal nerve. To assess for the glossopharyngeal nerve, pause. To assess for the glossopharyngeal nerve, we are going to use the tongue depressor. With your tongue depressor, you can place a sweet taste at this anterior aspect here. You can place even sugar at the anterior aspect of the tongue depressor, and then you put it at the posterior 1/3 of the tongue. If the patient tells you that he's capable of feeling a taste, that's a sweet taste, it means that that's a normal glossopharyngeal nerve, because the glossopharyngeal nerve supplies the posterior aspect of the posterior 1/3 of the tongue. Similarly, you try to ask the patient to say ah when you protrude, when you depress the tongue. Exercise the tongue and ask the patient to say ah. Please come closer. Ah. You see how my uvula is moving inside. And lastly, you put the tongue depressor slightly in and touch the uvula to have the gag reflex. That's the gag reflex. That's the gag reflex. So you try to evaluate, and the gag reflex both evaluate the cranial nerve 9 and the cranial nerve 10, which is the vagus nerve. Similarly, for the vagus nerve, you have to ask the patient to swallow. When you swallow, it tells you that it's both the glossopharyngeal nerve normal and the vagus nerve normal. And lastly, you ask him to speak as I'm speaking here. If you have a change in the sounds, it means that the vagus nerve can be affected. Now, the next aspect, you are going to have the accessory nerve. For the accessory nerve, what you do is that you ask him to elevate the neck. Please elevate your neck like this, and then you press it. This is to assess the trapezius. And also ask him to turn the neck. Please, can you turn your neck and push my hand? You assess the the sternocleidomastoid. Please can you push on this other side? So that is a normal accessory nerve function. And then last one is the hypoglossal nerve, where you're supposed to see the morphology of the tongue, if there's any deviation of the tongue, and also to visualize the tongue can move in different direction. The next aspect